Now let's take a trip to north central Louisiana and the Monroe area. That's where LDH is reporting close to 1,500 confirmed coronavirus cases, just under 60 deaths, and more than 13,000 tests completed there since this pandemic began. With that, we're going to take you to our Monroe affiliate, KTVE, where Michelle E. Martin and Bodie Brooks are with U.S. Representative Ralph Abraham.
Dr. Abraham, thank you so much for joining us.
Hey, thank you very much.
So a few questions to talk about. Obviously, an unprecedented moment happening in our time. And one of the first things that we want to look at is, obviously, we're on that path to recovery. The administration has said that we can protect both lives and livelihood at the same time. And what are the first steps in reopening Louisiana, specifically Northeast Louisiana?
We're seeing some cases, certainly in Northeast Louisiana, and Washita Parish seems to be one of the hot spots that we're seeing now. The rest of Northeast Louisiana, more in the rural parishes, certainly have their cases, but not nearly as bad as the New Orleans and the New Yorks of the world. So to get back to what we hope is a normal business climate, then we start reopening these businesses slowly, with people understanding that there still has to be some distancing, there still has to be some masking, those types of things that do help prevent the spread of the virus. But we also know that this is a very widespread airborne virus that is well dispersed, and more likely than not, eventually you're going to get exposed to it one way or the other, and that's where antibody testing comes in.
Congressman, as you said, Northeast Louisiana is very rural. State leaders have said that the key to reopening the state is more testing. However, a lot of these rural parishes are reporting very little testing, some less than 100, as opposed to Washita Parish, where we have tested thousands of people now. How do we expand testing in these rural areas, and can we currently rely on the case numbers we're seeing coming out of these parishes?
Well, I think you can rely somewhat on the case numbers. Again, the people that are going to get sick, there's enough fear out there that if you have fever, cough, sore throat, the big medical attention. The question is how many people have been exposed, have developed the antibodies already to the COVID virus, and never knew they were infected. I truly believe, personally, that number is going to be in the 30 to 40% range.
Now, Dr. Abraham, you have the benefit of both being a lawmaker, an elected official, and being a medical doctor, and in a rural area as well. Now, lots of residents are having a hard time following those mitigation efforts. And as a doctor, I want to ask you if you've seen an impact in your own practice. I mean, you have your white coat on right now. What's it looking like where you're working?
Well, we are seeing, some sick people of a variety of ailments. The thing that we have to remember that people still get sick from certainly other things other than the coronavirus, the diabetes, the hypertension, the cardiovascular diseases. Those things must be addressed, because simply if they're not, then those people get sicker and sicker and sicker. So in this clinic that I'm working with right now, we're seeing a little bit of both. We're certainly seeing those people that come in with the sinusitis, the fever, the cough, but at the same time, people are starting to come in for their routine checkups, because they know if they don't, they could easily end up in the hospital.
Congressman, right now, Washita Parish is reporting almost 800 cases of COVID-19. Now, just weeks ago, we were seeing numbers like that in Shreveport, and their cases now are doubled from that. How concerned should we be about Washita reaching cases like Shreveport or even New Orleans?
Well, you have to be concerned, and again, that goes back to the previous question of testing. The more we test, certainly the more people that we're going to find that are either mildly symptomatic or completely asymptomatic. But the difference will be how many people we can get to test. I go back to the antibody test. Once it's widely available, and it's coming soon, then I think we're going to be pleasantly surprised at how many people are immune to this COVID.
Abraham, kind of shifting the conversation a little bit, looking ahead to our landscape in Louisiana, our economic landscape in Louisiana, we went from having the lowest unemployment numbers in the history to the highest since the Great Depression. Here in Louisiana, a lot of people are filing unemployment at numbers that we've never seen before. Once the state reopens, once the economy reopens, how do we continue or build towards that success that we once saw pre-pandemic times?
Well, we've got to get back to work in every aspect. Even us in the House, we're not going to Congress right now. The Senate's in session. We need to be in session in the House, but unfortunately, the Speaker is not allowing that to happen. As far as those that are having the jobs that they need to go to, that the jobs need them to be at, you do the smart things, you do the common sense things. And again, as Americans, we are smart enough to know how to protect ourselves and, as important, how to protect our family workers against exposure. So you do the things that we have been told to do over and over, and that is some social distancing, some masking, those types of things. And if we do that, and if we get back to work at the same time, I truly believe those things can cohabitate well together.
Now, if I'm someone who has lost my job, I'm now unemployed, how confident should I be that my former place of business may have gotten a PPP loan? And if so, should I be considering, them possibly rehiring me, or should I start looking for a new job? And if so, when? Eventually, I'm going to have to go back to work.
We hope they rehire. That's our fear on the congressional level, is that because of the economic problem and almost the bankruptcy that it has caused some businesses, that businesses may not be able to rehire long term. The PPE loan, or the money, is available for only 8 weeks, and we understand once that runs out, those businesses have to be viable enough to support a payroll. So we are very concerned about that on the national level. Only time will tell, but again, we need to get back to work very quickly here.
Dr. Abraham, I want to circle back to something you said in the not this last question, but the one before, with regard to, clearly residents are smart enough. We know how to take care of ourselves. We know how to keep ourselves safe. But I have to ask this question. Even here in Ouachita Parish, other parishes, we see a flattening of that curve. Here we see continued and an increase in case numbers. So how do we equate for that? How do we explain that?
Well, just increased testing, I think. Again, so there are pockets of people that have not abided very well by the rules and the advice that has been given. How do you correct that? I don't know if you can. That goes back to the people themselves trying or wanting or needing to do the right thing. But again, as more we test, the more we're going to find positive. Now, just because they're positive doesn't mean that they're hospitalized. It doesn't mean that they're on the ventilators. Most, probably 99% plus of the cases that are symptomatic can be treated outpatient, and they do very well. So the numbers are worrisome for sure. I think they will continue to go up as we increase testing, but at the same time, most of those patients that are symptomatic can be treated very easily and very adequately in a home setting.
Thank you so much for taking the time out of your very busy schedule. Again, out there serving the people in the hospital, working, and we just appreciate you taking that time to stop and talk with us.
Thank you very much.
All right, back to you guys.